scientists. We have these two gentlemen with us today, and I'm going to introduce Dr. Khalil Sivjee and Dr. Vipan Nikore. So Dr. Sivjee is a respirologist or lung specialist. He is our medical director at Cleveland Clinic, Canada, and he received his medical doctor at University of Connecticut. He did a residency where he was chief medical resident at Yale. And he also did a fellowship in pulmonary and critical care at Cornell. He's assistant professor at University of Toronto, and he's really a leader in medicine. We're lucky to have him. He's also corporate medical director for Fairfax and RBC and so forth. So welcome. Dr. Nikore is an internal medicine physician at Cleveland Clinic, Canada, as well as Cleveland Clinic in Ohio. He's a corporate medical director as well, another medical leader for TD Bank. He's assistant professor at U of T, and he did his training, his medical degree at University of Illinois in Chicago, residency in Cleveland in internal medicine, and did an MBA at Yale. Hardly seems enough, Vipan. And he also won the coveted award for young leaders in Canada. It's called the Top 40 Under 40, and he won that award several years ago. So welcome to both of you. Thank you so much for coming back again. And perhaps you could tell us over the last, I think it was 7 weeks ago that we saw you, how you're doing now. And if you could give us one positive thing that has come out of COVID-19.
Go for it, Khalil.
Want me to go first?
And thank you. Thanks for having us as well, Cathy.
Thanks for those introductions. And I just want to say, while it's impressive that Vipan got the top 40 under 40, the only reason I didn't get one is because they don't make a top 60 under 60. So when they do that, I'll apply. You know, it's great to be back on the show, Cathy, and I think you've done some great work helping us all sort through some of the really tough challenges that we've all been experiencing. I'll tell you, I was just saying this to a group of leaders at Cleveland Clinic a few minutes ago. The thing that's impressed me the most is that when we trained, therapeutic touch, holding a patient's hand, putting your arm on their shoulder, there was no substitute to that. You couldn't really connect with a patient unless you had them really close to you. And we've been forced to challenge that notion. And I'm now convinced 2 months later that there is something about therapeutic connection, that you can actually get close to someone even though you're not physically close to someone. And it all has to do with listening skills and being empathetic and compassionate, but it really does work. It takes some practice. It's not intuitive. And for someone, an old guy like me who's been seeing patients in person for 25 years, it was a big shift. But it is possible, and that's been the thing I've learned the most over the last couple months.
Great.
Age is relative. Cool. We won't go there.
And you know, on my end, are you finished, Khalil? Just
yeah, go ahead.
Perfect. On my end, in terms of how I'm doing, I'd say, you know, a little bit better than I'd say a couple months ago when I look at sort of the craziness when it all was just starting. It was new. We still obviously don't know. Well, we know some, but we have a lot more to learn. But, you know, at the hospital, you know, at TD, in all the different roles, everyone was sort of shifting, figuring out what to do. And the shifts were happening extremely fast. So I think there was a lot of just general chaos, obviously, in the world everywhere. And I do feel like it's calmed down a little bit, even though we have a long way to go still. So that's how I feel personally. I'd say a little more calm from that perspective, which is nice. When I look at sort of the positives, I think there's a lot of things that have come out from society. The speed, for instance, the speed at which technology is adopted, from, you know, virtual care to even, you know, some forms of remote monitoring, et cetera, within healthcare. And these are some, you know, I started working on telemedicine in 2003 at UCLA, and I wrote it in all my business school and med school apps. And At the time, people thought it was kind of strange, or obviously I sold a few people on the division, but it really has taken a pandemic to accelerate some of these technologies, which in the long run, hope will help save us costs. And even just from an infection control standpoint, I think we're going to be better in the future. I hope more people get their flu shot. I hope that all of this will lead to deaths. Fewer deaths in the future. And I also think we've learned we can work from home better, just in general. We've realized, maybe you don't have to fly to, Japan for that meeting, and you can maybe do it virtually, as an example. And the last thing I would say is I do think, as a healthcare worker, when I look, my father is a physician, and I look at sort of the respect amongst all healthcare workers, not physicians, nurses, PSWs, whatever it might be. It is nice to see increased respect for physicians, not physicians, all healthcare workers. I think that's just nice to see. It's a positive there. So.
Mm-hmm. Certainly, we're all out on the street banging pots every night for sure, just in gratitude for all the frontline workers, for the people that are doing stocking the shelves at the grocery store, for the people delivering the mail, for all the people that are providing essential services. So great comments. We're going to dive into this COVID-19. We've got a bunch of questions. Some people have sent questions as well. So we're going to start going through those. And if people in the audience have questions, I know that Sophie's collecting them, and she's going to send them on to me as well. So starting off, we have talked to this before, and I always love hearing Dr. Sivjee talk about the ballistics of respiratory droplets. And the reason I'm bringing this up again is it does have something to do with how we move forward with the return to workplace and so forth. And it also explains a little bit about this magical 6-foot distance or 2-meter distance that everyone keeps talking about and so forth. Things have changed a little bit. We're talking more about asymptomatic spread and so forth now. So maybe Dr. Sivjee, Khalil, maybe you could talk about these droplets again, and if there's been a change in thinking in any way in terms of the spread.
Yeah, so I think that the way to think about respiratory droplets is probably in 3 different buckets. The first bucket is what's depicted in this cartoon, which is someone who's clearly symptomatic, who's clearly coughing and sneezing, and those respiratory droplets they're producing are traveling 2 meters. And they're landing on surfaces, they're landing on this other person in the blue here, they're landing on their hands, and this person in the blue then is susceptible to touching their own face and getting the virus. But the other 2 buckets that have emerged are, as you mentioned, the asymptomatic spread. It's a recognition that a couple things happen before you have symptoms. So if you have the virus, probably the day before you have symptoms, you have a similar number of viral particles in your airways as the day after you start having symptoms. And so could you, in the course of just breathing or speaking moistly, as our Prime Minister made famous, spread respiratory droplets? And in theory, that can happen. And so there is sort of an acceptance now that asymptomatic transmission, it's really pre-symptomatic transmission, because I think the number of people that are completely asymptomatic and walking around with the virus is very, very small. But pre-symptomatic transmission is possible. And so it doesn't change the fundamental principle, the 2 meters still stands. I think the third bucket that has now emerged is this idea of aerosolized respiratory droplets. Do the respiratory droplets float in a cloud in the air? Can they get sucked up into your ventilation system and go from building to building and floor to floor? Could there be a cloud where you're walking on the sidewalk where someone was just there who had the virus, and a cloud of viral particles? I think that's the least credible of the 3. There hasn't been a ton of evidence that there is transmission through HVAC from floor to floor, from building to building. And this is going to become more and more important as people start to re-enter the workplace, because you're going to have to enter elevators with other folks. And I think if you have a face covering to limit the number of respiratory droplets you're creating, pre-symptomatically or asymptomatically, and you maintain the 2 meters whenever possible, and you wash your hands like heck, I think that's the best defense against spreading this virus.
I actually just had a question. And this person says, I'm 70 years old. I'd rather be beyond the 6 foot, 2 meter distance. Should I be even further away? What would you say about the elderly population, especially with some of the people returning to work? Should they be returning to work at this time?
Yeah. So I think there's 2 parts to that answer. The first part has to be a recognition that while the majority of people who get the virus do very well, create antibodies, their immune system kicks in and they kill the virus, there is that small percentage that get very sick, end up on Dr. Nikore's ward in the hospital or in the ICU, and unfortunately some of them die. And if you look statistically, the overwhelming majority of the people that succumb to this disease are in that older age group, as are other folks with compromised immune systems. And so there is a heightened concern for our seniors and for older folks. So with that recognition, however, the spread and the epidemiology of this doesn't change. So to the specific question, should I be more than 2 meters away? There really is no evidence that these respiratory droplets travel further than that. The only exception to that is in a hospital where they're doing what are called aerosolized generating medical procedures, like nebulized medications, bronchoscopies, intubations, all that stuff that Dr. Nikore does when he's in the hospital. In that setting, you need to be obviously not anywhere near that patient, and if you are, wearing full personal protective equipment with an N95 mask. So the elderly are not more susceptible to getting the virus, especially if they're following all the public health guidelines, the 2 meter distancing and the hand washing. But if they get it, they're more likely to get sick from it than someone who's younger. I don't know, Dr. Nikore, do you have anything to add to that?
No, I think that's great. Probably the only thing I'd say, the one advantage of being, perhaps a little more than 2 is that you just don't know behavior. So if you always, imagined everyone was 2 meters away and you don't know that other person, they might move in closer and sneeze on you or something along those lines. But, that's the only reason you would want to have a little extra safety there. But that's just so that they don't move within 2 meters, if that makes sense. So you say 3 meters so that if someone comes within 2, you've got a little more cushion. And then what I would probably say is just going back to the mask issue you had mentioned, you put everything so eloquently, not too much to add, but one way to look at things, because sometimes people say, oh, it's changed on masks, and nothing's really changed. If you do a thought experiment and you imagine, you're trying to decide if you should have a mask on when dealing with an infectious disease. Imagine you were in a world where everyone was completely densely packed beside each other and you didn't know who had it, but you knew, 90% of the population had it. Almost every single person had it, and most of those people had symptoms. That would be a world where wearing a mask, I could, say is pretty safe to say you should wear a mask. If everyone wore a mask, the transmission between people would almost for sure go down in that world. On the other extreme, if it was a sparsely packed area, if barely anyone had the virus at all, and you probably don't need masks in that area. And what's happening here is, where in the middle does it switch from that extreme on the end where it's densely packed and you for sure should, and on the other end where you for sure shouldn't? And that's why it's really difficult, because we're getting closer to a point where there is some density and it's going to be very regionally dependent, but really those are the factors, number of infected people in the area, the density of people, the infectiousness of the disease, and then the behavior of people wearing the masks as well, because you can touch the front of the mask and more people can, transmit it through that mechanism as well. So it's really important. Nothing's really changed about masks. It's just that the amount of coronavirus cases have gone up in many regions, which has brought it to a blurred line where before it didn't make sense, and it may make sense. Hopefully that makes sense.
Mm-hmm. Well, it happened to be my next question. So I wanted you to talk a little bit about this because we talk about face masks, but we also talk about face coverings. And people are wondering, when they go out shopping, should, generally speaking, if you were held up to the fire, should they be putting a face mask or a face covering on when they go shopping, when they go walking, when they go back to their workplace? You're with TD Bank. I'm going to put you on the spot. And, should the employees at TD Bank be wearing a face mask or a face covering of some sort? And the second part, I'm going to throw a lot at you, is if they are wearing these coverings, like a cloth face covering, how often should they be cleaning it? Is it, washing it every night sufficient? What is the recommendation? And I know it's all new stuff, but you're the trendsetters here. So fire away with your thoughts on that, Vipan.
Sure. So I kind of, explained my general thesis just now in terms of, and that's why I would say it's very regionally dependent in general. And as the density goes up in the population, if you're teaching people how to use that behavior piece, as if you looked at those 4 factors, if you can make that piece better and you can educate the public on how to improve using masks, the advantages as densities are up and we're being cautious probably move up in terms of using face coverings. In terms of, Khalil mentioned this earlier, in an elevator, is there value? Yeah, probably, because you've got a few people in that elevator. And if people are going to go back to work and we have to think about how we can open up our economy safely, that could be a mechanism, because if you have one person in an elevator, how are people actually going to get up there, right? So you have to have a few more people. You have to take a little higher risk there. So maybe to decrease the risk, you use the mask or face covering in those situations. But then, it's hard to individualize as well. There's certain areas where what are you going to say? Well, in the elevator, wear it. If you go here and wear it. So it may, from a policy perspective, be easier to say, just wear it. I'm not saying that's the answer, but when you're thinking about where to use it and where not to, hopefully.
Well, that's a good answer. So, it sounds like basically you're saying we should be wearing some sort of face covering. And in terms of elevators, what do we tell people about elevators? Because it's hard to maintain a 6-foot distance. How many people in an elevator? And even at our downtown office, we're on the 30th floor. A lot of people got to get up that building. So,
Cathy, I want to just clarify one thing. I wouldn't say, I lean towards people wearing face coverings in many situations. And I know I'm kind of being a little of a politician here, the way I'm wording things, but, it is important, a place, New Brunswick, now they did have a new case, but there's a lot of places where, it's gotten a lot better and the density has gone low. And you look at those 4 variables, you probably don't need a face mask in certain areas or certain conditions there. So I do think there's a regional dependency around this.
Sure. Yeah. Anything?
Khalil?
Yeah, no, I'll comment. I agree with everything that Dr. Nikore said. You also asked, Cathy, how often should they be changed? I think that it's important to note that face coverings and surgical masks are essentially the same thing in terms of they don't protect you from getting the virus. They reduce the chance that if you have the virus that you're going to spread your respiratory droplets to others. So it's very important to, I think, for people to understand that masks don't protect you from getting the virus, they protect you from spreading the virus. And so if that's the case, then, you got to look at the best analogy I've heard about this is if you had a bunch of Swiss cheese, right? And those pieces of Swiss cheese have holes in them. And those pieces of Swiss cheese are your barriers against getting the virus. Well, if you only had 2 pieces of Swiss cheese, then the holes might align and the virus might get through and get to you. But the more pieces of Swiss cheese you add to that stack, the less likely that all the holes will align and get through. And so what would be examples of those barriers? Well, physical distancing is one of them. So staying 6 feet or 2 meters away is one of those pieces of Swiss cheese. Wearing a face covering could be another. Hand hygiene's a third. Only going out for essential things and not cohorting with more than a certain number of people. So it's not the be all end all, but it likely contributes to a decrease in the transmission in the community. But as Dr. Nikore pointed out, we'll get to a point, and some communities have already gotten to a point where it simply doesn't make sense because the amount of community transmission has basically gone down to zero. In terms of cleaning them, if you are using a disposable paper surgical mask, obviously that needs to be disposed of at the end of the day or whenever it gets wet. And for cloth mask, for sure, needs to be washed at the end of the day. So wouldn't wear it more than a day.
Great ideas. It sounds like we're not going to get away from, it's important to have the 6 foot distancing still, like we've all said, and the hand washing are key, and the face coverings add perhaps another level or another piece of the Swiss cheese. So so good ideas. There is still confusion around what's quarantine, what's self-isolation. Perhaps one of you could speak to that and give some examples of when you do what and what it implies.
Sure. Oh,
go ahead.
Sure, I'm happy to tackle it. And it's important to note, you know, sometimes people won't use the terms properly. So it's just important to be aware, to not always take it so literally, because I probably even made a mistake where, you know, casually said something and said it the wrong way, because they are similar concepts, in full transparency there. But, you know, generally speaking, the technical term in terms of quarantine is if you actually don't have symptoms and you've been around this is not the technical, this is the conceptual term, I should say. When you have been around someone, for instance, who may have caused you to be exposed, and therefore you now may or may not have the virus, but you want to be essentially, and I try not to say the word isolated in my definition, but you don't want to be around because other people, because of someone else possibly making you exposed. Whereas isolation generally means you actually have the virus or you have symptoms itself, and there's subtle differences. And, you know, at TD, I've had to use both almost every single day the last 3 months, but that's the general concept. I don't know if you want to add anything there.
Yeah, I think I don't have as much of a memory as you do, so I come up with acronyms, and my acronym for how we're going to manage this going forward is TICQ, T-I-C-Q. And the T stands for testing. So we're going to continue to test a lot of people. The I stands for isolation. And so if you test positive, just as Dr. Nikore said, you have to be isolated, which means you're not getting near anyone. You're not sharing surfaces, washrooms, countertops, dishes, as much as that is possible. The C is contact tracing. So anyone that you've been around needs to be identified. And then the Q is quarantine. So they need to be on quarantine, which means they need to stay out of the limelight, stay home, not necessarily isolate, but stay home and monitor for symptoms very closely.
So, and what's happening with testing?
Vipan, you want to?
Sure. So, you know, testing is something I'm quite passionate about. I probably wasn't as passionate about before coronavirus, so I'm not that nerdy. But in the last couple of months, I can tell you, you know, from a TD perspective, when we were reviewing all the cases from January and then where it started to come into community transmission, there were really so many times I wanted to get tests and just wasn't able to. And you're forced to either make a decision where you almost, you know, essentially quarantine the entire region based on somebody's subtle symptoms. And at that time, we still had journal articles we were reading that we knew people with subtle symptoms were transmitting this virus. and that there still was a chance of some people having asymptomatic transmission. And I would want to get certain people tested, but it just wasn't possible. So I'd either have to say, well, just go back and work once your symptoms are better, which is a risk, or you kind of take every single person and you assume that they may have had an exposure. And I took generally the more cautious approach and took everyone out. But, how are we going to get people back to work if I have to keep that approach up for, the entire year, as an example? So, I personally was able to really see if we could have just tested that person with an accurate, fast test, we could know immediately instead of needing to shut down an entire branch, as an example, right? So that's one sort of real life example. So I'm not, I haven't really answered your question there, but I think some things are around even cultural norms. Sometimes, we do live in a society where our costs are in medicine, in healthcare, 40% of our budget, we're taught we want to be mindful. We know that there's negative things that can happen out of testing people too much at times. We always want to be mindful of that. And there is often within the medical community cultural norms, I think. And when we're dealing with a pandemic, I don't think there's a time to be cautious. I got tested at one point when, I work in a hospital. I had even the mildest of symptoms. I was negative, right? But, I didn't hesitate. And if anyone has mild symptoms, I think they should be tested. In areas where there's logistics, which, are probably more at the government level. Part of that is also, it's a new test, right? So some aren't accurate. So we need to, and an inaccurate test can be worse than an accurate test. Than no test at all, because you're falsely letting someone back in when they don't. So, governments, people, it's not magic that, you just, have a virus and the next day you have a test. So it can take time. I think those are probably two or three of them. And also speed of innovation in the society can matter as well. Some places, some countries are just quicker. China built a hospital in 8 days, right? So some places are just quicker at getting things done. So
we did, Vipan, have a question on contact tracing as well. And you're with TD Bank, and if someone has a positive COVID in a branch or what have you, they want to know how you do the contact tracing for TD Bank. Do you use public health? Who do you use, and how effective are they?
It's a good question. So, probably since at least for over 2 months at TD, we've essentially had our HR team, many people on our HR team, trained to do contact tracing. Because early on, when we couldn't get through to public health because the volumes, they were calling our TD HR line, and the calls went from around 300 a week to like 1,700. So it's pretty remarkable what TD did. They more than doubled their HR team to handle the inflow of calls. We created a guidance matrix, and essentially the HR team, we developed a system where they were almost all contact tracers, and we would still have them call public health in their region to make sure that they're following local guidelines, but at the very least they had a matrix that they could follow that was set by myself and our team to make sure that they knew to stay out for 14 days, be isolated, etc. So it's I think worked overall quite well. So,
Khalil, do you think we're doing enough testing?
Yeah, I think the short answer is we're getting there locally in our province. The goal set forth by the premier, which makes sense, I think, is 20,000 tests a day. We're almost there. I think testing has to be smart testing, though. You have to remember what, this nice little picture that you have on the screen here, what they're actually testing for. They're testing for bits and pieces of the virus, specifically the genetic material in the core of the virus. And so what you're testing is the presence of that genetic material at that minute that you're testing. It doesn't tell you what happens that night when the person gets on the TTC and goes home and comes in the next day. And it's impractical to test everyone every day. So I think smart testing, targeted testing, it makes sense. Certainly testing symptomatic people makes sense. But in addition, testing contacts and people that might have been at high level of exposure is important as well. I want to say one thing about contact tracing, if I may. the way that contact tracing is done, of course, is you go in and you find out who was close to that person that ended up testing positive. And we have to define that somehow. And Dr. Campbell, as you well know, because you've helped me do a lot of this contact tracing, we've defined that as someone who has been within that 2-meter radius for greater than 30 minutes. That is how you identify contacts of people that are positive. There's unfortunately been a reverse engineering of that definition such that some people feel, oh, okay, so if that's a close contact, then I can be within 6 feet or 2 meters of someone for 29 minutes and that's okay. And that is clearly not the truth. To reverse what the definition of contact tracing is, and then be cavalier and be in close contact. You are still at risk. It's just at some point we have to draw a line and say these are the people that are at most risk, greater than 30 minutes within 2 meters. So I just want to make sure people don't misinterpret how we do contact tracing to justify behaviors that are unsafe.
Yeah, good point. And I'm going to keep you going there, Khalil, because I know that you are the shopper in your family.
Yeah.
I know that I believe you do the grocery shopping for your home. And so here are a number of questions. One is self-checkout safer than going to the cashier? And when you do come home with your big bags of groceries, what do you do with them? Do you clean them? Do you wash them? How do you integrate them into your little bubble at home?
Sure. So I think first principles always apply, which is if you're not well, don't go out. And so if I had any symptoms, I wouldn't go shopping. And secondly, stay 6 feet or 2 meters apart. If you can remember those two things, wash your hands the second you get home, then I think it's okay to go shopping. In this picture that you showed, obviously that middle kiosk shouldn't be activated, so it should be off, and the 2 edge ones should be the only ones that are on. In terms of should you go to the self-checkout or the place where I go, and I won't name the specific store, but they have very nicely distanced people with markings on the floor. When you get to the checkout, the person is behind a plexiglass shield. They have hand sanitizer available for you there. And so I think it's a very safe situation. And so there wouldn't be any difference in my mind between self-checkout and going up to the till. In terms of the bags, as I mentioned, the virus does last on surfaces. We know it lasts for a couple hours, and depending on the surface, it could last up to a day or so. The more absorbent the surface, the shorter it will last. And so I do use my cloth shopping bags where they'll allow it. And if they are plastic and they force you to use plastic, and some of the outlets have gone to that, I do leave the bags at the front door, take the stuff out, put it on a counter, wipe it down, and then dispose of the bags, or leave them in the garage for some time, because a few days later the virus would be gone even on plastic surfaces.
And we should also we always do wash our fruit and vegetables and so forth anyway. So great ideas. We're getting down on time, but I want Vipan to quickly give us, which is not a quick answer, but if TD Bank, for instance, if employees are going back to return to the workplace, because we're all returning from home, what are some of the things that you think about in the return to the workplace, especially considering we don't have a vaccine yet?
Yeah, are you talking about in terms of like when to open up, in terms of like testing and whatnot, or do you mean at the individual level?
Right.
Just want to clarify. I'll start.
Yeah.
At
a branch.
Yeah. So a lot of it really comes down to regional in the amount of community transmission happening, and some of the things that we can look at are how many cases, how many deaths have there been, and cases and hospitalizations. What's the rate of decrease of those? We talked about testing. How much testing is happening in that area? how well are we doing in terms of contact tracing? You know, those are the factors that I think we have to look at, and also behavior of the population and people. And it's interesting, you know, when I see people bunched up together in there protesting, that actually gives me less confidence in that area that they're ready to open up. Because if they were, you know, socially distanced and they were protesting, at least I'd have a little bit more, and they gave a good argument, I'd think, okay, they may have an argument here. But if they're just running together and they're ignoring the science and the public health measures, so there's actually things around behavior, even, you know, if within a region we're seeing just lots of behavior, or if there was within a branch or something where people weren't understanding the science behind it, I'm going to feel less confident opening up in that region. So those are the factors that I look at.
So there's lots of education, obviously, that you do to make sure that they are ready as well.
100%.
For sure.
100%.
I'm going to skip to this question because it's also on everyone's mind. Like, we're all COVID-19. But what if I have high blood pressure? I need a refill on my medication. My family doc perhaps is closed, or there's no online through the family practice office. Where can I go to get care?
So I'll start, and then maybe if Khalil has any other thoughts on things. One thing I would say, particularly if it's something that you sort of deem as a little bit more serious, and I know that can be difficult for patients to sort out themselves, but I'll start with that. You know, I think people should go to the ER. You know, I know, you know, are the cases we have and the way that ERs are set up, I think people do a pretty good job. And I have seen too many people where, you know, they've suffered needlessly when they really probably should have gone to the ER and things could have been sorted out. Obviously, if you can get through your family doctor, you have a family doctor and you can handle most things, that's ideal. But, you know, good precautions are taken generally in most ERs in terms of how they're set up. So that's my thought, especially now as the numbers are starting to come down a little bit, and, you know, people, you can only wait so long as well. So I think this is really important. So,
but just to plug us a little bit, we have online services that anyone can log into from 7 a.m. to 7 p.m. every single day. So if, you know, if you need a refill for a blood pressure medicine, you certainly don't want to be going into a COVID infested. If you're seriously ill, you need to get to the ER. But
exactly, and that's why I mentioned it being serious. And then I was going to punt it over to our medical director, Khalil, who I thought would make that highlight that piece. But it sounds like we've got
it sounds like you covered it.
Now we have many more questions, but we've run out of time. We have answered some of the questions and answers there.